This video will give you a tour of the spleen stained with H&E and the spleen stained with a silver stain to highlight the reticular fiber network in the spleen, and then a spleen with sarcoidosis, a collection of granulomas where inflammatory cells form nodules, but this particular spleen has good features of normal also. So now let's look at the normal spleen stained with H&E, and the first impression is you're going to just see white and dark, well, not white, but reddish and bluish areas. And the reddish areas are white pulp, and excuse me, that's exactly wrong. The reddish areas are red pulp, and the bluish areas are white pulp. And the concentration of lymphocytes is greater in the white pulp, where you see the blue staining reaction, because it's a reflection of this close concentration of lymphocytes, which are reacting with the hematoxylin in the stain. Whereas the red would be red blood cells in the sinusoids in the red pulp. So this particular spleen, you can see nodules. The spleen is not particularly active because you're not going to see any germinal centers in the nodules in this spleen. So if you look at the, say, let's just magnify this and pick, let's say, this particular area here. Here is a central artery, and this is a primary nodule that is projecting off to the side of the central artery, but it has no germinal center in. But this is where most of your B lymphocytes would reside. And if this were active, you would be much larger nodule, and you would have a light center, a germinal center. Now let's pick another area. Here is a central artery where it has a cuff of lymphocytes. Here's the artery, here's a cuff of lymphocytes, and this is what runs throughout the spleen, and occasionally you have the nodules that we just saw. And that cuff, the concentration of lymphocytes there are mostly T lymphocytes. So then out here you see all this red area are red blood cells, and it's a little hard in this specimen to recognize the cords of Billroth and the sinusoids, but both are present here, even though they're not very well defined. That's why we're giving you another specimen to look at. So here's a good example of the close to a nodule. Let's see, just one more example where you see the cuff of lymphocytes and a cuff of lymphocytes here. And you have learned in lecture that this is a means around arterial or lymphatic sheath. So a sheath of T lymphocytes surrounding the central arteries is the periarterial lymphatic sheath, which is known as the PALS, all capitals. Okay, let's go to this annotation where I have found and annotated for you a sinusoid with red blood cells and different white blood cells within it, and then along here you have the endothelial cells of the sinusoid, and then out here this is the X showing a cross section of a sinusoid, and this tissue here and over here are the cords of Billroth, where there's a population of macrophages that attacked old or defective red blood cells. Recall that the red blood cell average length in age or years is 120. Not years, but days, 120 days. So let's take a look at the next specimen, which is stained with silver. I'm not going to spend a lot of time on this specimen, but if I zoom in, let's say in where the red pulp, you can see the outline of the sinusoids and the network of reticular fibers in the cords of Billroth. Now, here I've shown you a central artery and a large nodule, which has a dermal center in it. And then in this particular annotation, you can see the cross-section of sinusoid and the longitudinal section, and the tissue between are the cords of Billroth. So understand, in the liver and the spleen, the reticular fibers form an extensive network upon which the cells are gathered together and organized, and many of them attached to that reticular network. So now let's look at this sarcoidosis specimen. These patches that I have outlined here is the area of the sarcoid, which is composed of giant cells, fused macrophages, and various other inflammatory cells attacking an unknown substance. We really do not know what causes sarcoidosis. Some think it's inhaled substance from the air. That would make sense in, let's say, the lung and maybe the lymph nodes related to the lung, but certainly not in the spleen. So, I outline the abnormal areas for you, but then I show you in this annotation several sinusoids outlined where you can see the cords of Billroth here, where the red blood cells are percolating slowly through a swamp and interacting with macrophages that will detect in aged red blood cells and defective ones. And of course here are the sinusoids. Okay, so that includes kind of a tour of the spleen specimen.